Ladies and gentlemen, I'm going to show you now the Vascomic disruptive technology. It's a new name that we get as our team, and we're trying to make it happen. Can we have volume, please?
Blockchain development. While this AI is already outperforming accounting firms. Meanwhile, the new graphic design AI aims to automate graphic design and could minimize the need.
Relax. Because in a future where AI does most of the work, there'll be one thing that humans will finally get to do all day long. Nothing.
That's happening currently, and if you don't share in what's ever going around us, we'll be unemployed. Current obsolete diagnostic algorithm, you think that you're doing great, asking for an MRI, CT scan, duplex scan, and whatever you're doing, and then you do some genetics for the patient, and you think that, perfect, I'm state of the art. And then you do a plan, you go to a dysfunctional MDT, you discuss the case, and you take a wrong decision. It's an absolute disaster and a criminal what we're doing now to our patients. Vascomic integrated technique mandate new ontological biological approach for cardiovascular disease. The lure of obtaining large data set will replace any clinical trial, and investigator must understand technical and biological strengths of Vascomics approaches. The virtual clinical trial simulator is a must that you have to understand doing it, because without understanding what's going on, you're going to subject patient to be as a guinea pig in your lab, which again violate their human rights. Radiation levels are currently dangerous. Modern imaging technology should be considered a top priority in every center, providing endovascular management of aortic pathology in order to attract trainee and educated patient. And remember, attract trainee is very important also. Individuals who underwent a procedure with augmented intelligence had superior outcome than those had procedure without augmented intelligence in the four major easy way to measure it: operative time, contrast, radiation exposure, and fluoroscopy time. So last year I was talking about general AI, and in less than 9 months we jumped to quantum computer and super AI. Super AI and quantum computer translation medicine, we have opened a can of worms, transformative advances in vascular clinical practice. Vascomics identify resilient vascular trainee, accelerate discovery of trainee vascular phenotype that withstand high radiation exposure, so that you will never hire a trainee that's going to get a cancer. AAA SAG volume mapping, enhanced predictive modeling, and personalized treatment strategy as it guides intervention based on SAG expansion as a surrogate endpoint. And lastly, the dynamic fusion imaging as it reduces interoperative radiation, intervention duration, and contrast use. Let's take one by one. We know that imaging, biological data set will give you the radiogenomics, which is equivalent to the vascuomics that we're trying to popularize these days. Moreover, the Vascomics in vascular care predict disease risk using tools like XGBoost and SHAP, and both of them had a fantastic article in New York Times yesterday. It's online, they're better than any professors or a clinical experienced guy in decision making. It guides patient care on precision risk profile that you are not aware of. Now, Vascomics in PAD and EVAR SAG behavior. Vascomics identify estrogenic pathway and creates therapeutic target to address AAA and peripheral arterial disease with CRISPRs, which is being done, and gene editing, which is being done to try to cure your problems. Integrating Vascomics into vascular training is a must, leveraging advanced genetic screening to identify RNA-resilient candidates against radiation, ensuring safer selection of vascular trainee. This innovative approach prioritizes radiation resistance, future vascular surgeon, minimizing long-term health risks, and mitigating medical legal liabilities while redefining safety standard in vascular medicine. Remember, professional fee doesn't equate for lifelong risk of radiation exposure. If you get lymphoma, or you get cancer, or you get leukemia, nothing will pay for it, for physician, for the hospital, and the patients. Significant diversity and abundance of gut microbiome. We just published this yesterday. Attacks are observed in Takayasu, giant cell arthritis, aortic aneurysm, and aortic dissection with greater dysbiosis compared to health control. We have seen beyond traditional intervention like fecal transplantation, probiotic, and dietary changes, Vascomic will enable precise modulation of the gut microbiome. The primary outcome will aim to prevent or halt the progression of aortic disease. Now, this is one of the revolutions that happened, which is the software being applied by CyDR, dynamic volume-based insight, as it tracks SAG volume and behavior over time, delivering critical objective insight into progression and treatment efficacy. This data-driven decision-making reduces reliance on subjective MDT consensus by employing predictive analytics for conflict-free, evidence-based outcome, so that you don't have somebody sitting in the MDT give you wrong decision-making. Intelligent smart fusion imaging must have to prevent stroke, and we use this through our fusion imaging, and it moves with the patient movement, whether the heart, the chest, the table, angulation, whatever you want. When you do an arch case like this, you need to be sure that you're doing the right way, and you do not whack the patient with a lot of dye and radiation. Now, you have to understand the technology of MyIQ image guided system, the authorized 6P control device, the OPS, AI navigation, and the OmniFly XR augmented reality. All of them are available, and you'll be able to apply it to your unit. Mr. Chairman, ladies and gentlemen, transforming antiquated medical education through AI and big data analytics both will set to pioneer a new era in precision medicine, redefining the revolution that's currently happening. Thank you so much for the opportunity.